There were two activities. As today we have a national seminar, and second we have a visit to Nobel Prize gathering. So to start today's session, I request our Dean sir, who is our guide, mentor, and always a force behind the academic activity. And fortunately, sir is from physiology, so he knows us. He always inspires us and always guide us in different activities which we are doing. Actually, sir is traveling. So, hello. So, just
Hello.
wait. Yes, sir. Yes, sir. We are able to hear you, sir. Over to you, sir.
Hello. Good morning. Thank you, Dr. Chinmay.
Thank you very much, sir.
Can we start? Can we start now?
Yes, sir. Yes, sir. Yes, sir. Please, sir.
Okay. I'm sorry that it may be difficult because of internet on the way, but anyway, I'll try. So, first of all, congratulations to Dr. Chinmay for organizing this seminar and inviting learned faculties like Dr. Archana Ghardial, Dr. Harpreet Kaur, and Dr. Hitendra Gupta for this seminar. I think this seminar will be very much useful for all the physiologists, not only to establish sports lab in the department, sports and exercise lab in the department, but even if they are interested in making career in this field, it will be really helpful for them. So I welcome all resource faculties and the delegates participating in this workshop. Thank you. Thank you, everybody. Thank you.
Thank you very much, sir, for making it possible to be part of the event. And thank you very much for constantly encouraging us. So now I hand it over to Dr. Chindapraj, who will lead the session. And I once again welcome all the three faculties, Dr. Ratna ma'am, Dr. Hitendra, and Dr. Harpreet. Over to Dr. Chindapraj.
Thank you very much, sir, for handing over. Thank you, our Dean, Dr. Hemant Mehta, sir. Thank you, Professor Dr. Chinmay, sir. And I welcome all of the speakers, Dr. Archana ma'am, Dr. Hitendra, sir, Dr. Harpreet ma'am, okay, and all the faculties and residents from other colleges and all over the states. Welcome you all. Thanks for joining. I will not waste much time. I know all of you are eager to listen to Dr. Archana ma'am. So I'll quickly introduce her and hand over the session to her. So Dr. Archana ma'am, she has an interest in lifestyle medicines and exercise physiology. She is also a fellow member of Indian Society of Hypertension. She is also a member of ACSM, APPI, IMA, and Indian Society of Sports and Exercise Medicine. She is also a member of Indian Society of Chronomedicines. Okay. She is also a resource faculty and a resource person in the medical education unit and masters in health and professional education. She has academic activities and experiences of over vast 21 plus years of teaching experience. She has 30 plus publications in national and international journals, 20 plus papers presented in national and international conferences. She has also authored chapters in 3 books, guided 5 PG students, 1 PhD students, and co-guided 10 plus PGs and 3 PhD students. She is also an active in NAAC quality manager. She has pioneered setting up exercise physiology lab in February 2023. She's also conducted exercise physiology workshop in SOPCon in October 2023. And she has also been President Appreciated Award at IMA Lucknow, October 23, 2011. I welcome you, ma'am, and I'll pass over to you to carry on the next session. Thank you, ma'am, and welcome.
Thank you, Dr. Twinkle. Share the screen. So, good morning, everyone. First of all,
Dr. Twinkle, please stop sharing your screen.
Yes, sir.
I'm sharing my screen.
Yes.
So first of all, I would like to thank the organizing team for giving me the opportunity to give talk on the topic how to establish an exercise physiology lab in your institute. My special thanks to Dr. H. Barun, President ISSEM, and his team for support and guidance. So I have shared. Am I audible?
Yes, ma'am.
I have shared my screen.
Ma'am, visible.
So exercise lab would play a crucial role in advancing knowledge, promoting healthy living, and preparing future professionals in exercise-related fields. As you know, the question answer session is at the end of the talks, but I will give you the link of Google form also to send question and queries. The link will be open for 2 days and I will reply personally to each. So agenda, I will cover my topic under following headings: about the physiology lab, how to plan to set the lab, various measurements and tests that we are doing, and SOP, and few slides about the fitness awareness program. As we have seen, during COVID time, people came to know about the importance of exercise and immunity. They did breathing exercises, took all types of Ayurvedic drinks and kadha without knowing the ratio or amount of ingredients. The best thing is people get aware of health and fitness. Health for All initiative aimed at encouraging citizens to lead a healthier and more active lifestyle. So making physical activity and sports an integral part of the daily routine for people across all age groups. So now being a doctor and physiologist, it's our responsibility to guide them how to remain fit and healthy. For this, we have to set the lab at various places. So exercise physiology labs have broad implications ranging from sports performance optimization to clinical applications and public health initiatives. So in my department, in KGMU, we are running this lab for research facilities and fitness awareness programs. We also teach the MBBS and MD students. This exercise lab is also related to the yoga. We can add yoga also in this lab. Our department, our physiology department also organizes annual yoga day. So now coming to the practical part or the most important part, how to set the lab, how to plan. Number one, there are 4 steps: team selection, vision, select the place and equipment, and SWOT analysis. So this one is selection of team. Selection of team is the important point. Excuse me. So selection of team, it's a teamwork. So find the positive and hardworking persons who want to work in exercise physiology field and serve others. Make him or her the team leader. So mainly the faculties would be the team leader. So then team of residents or demonstrators, we need technicians, digital record keeper, and helpers also in a team. But initially, if you have less faculty members or no PGs in your department, then one person may take up multiple roles. Example, a resident or the faculty can also take the role of digital record keeper. Then set your vision. Clearly defines the objectives and goals of your exercise physiology lab. Determine the types of experiments, what do you want to assess, and research studies to conduct. So vision may be related to the teaching of MBBS or the MD students or other students or the public, research awareness program or the camp. Through camps we can aware the people. Then collaboration with sports medicine or other departments for biochemical parameters. So the team has to set the vision together. Next is to identify a suitable space within the medical institute for the exercise physiology lab. Give priority to the room with cross ventilation. Don't go for AC room, because we have to take deep breath also. We are doing exercise. So healthy environment should be maintained. So consider other factors such as lighting and available utilities. Better make your room or the hall or your lab a stress-free zone or the fitness zone full of positive vibes, where everyone feels good and relaxed. You can use, if you have no space, so to start, you can use human lab also. Because in human lab, for MBBS teaching, we have so many instruments. NMC, according to as per NMC, we have to purchase these things for MBBS students or the MD students. See, most of the instruments are available in physiology lab. So be creative, set and start exercise physiology lab without waiting for budget and advanced instruments. Key point. Analyze your strength, weakness, opportunities, and strength. Then sit with your team and discuss about these things, about the strength and the weakness, opportunities, and the threats. Strength and weaknesses cover your own resources and processes, while the opportunities and threats pertains to conditions outside your organizations, like regulations. So do SWOT analysis, set your lab as per your requirement and goals. Based upon your vision, what do you want from your department after 5 or 10 years? I'm giving the two examples of the rural institute and urban institute. SWOT analysis. If you belong to rural institute, then positive part is place. You have a large place or the large building, you can set a big lab. Opportunities, bigger impact because less awareness. Source local items at less cost. Weaknesses or the funding and the manpower. Rural areas often face challenges in attracting and retaining healthcare professionals due to factors such as limited amenities like accommodation and children education. While in urban institute, they have better access to infrastructure, they have advanced medical equipment and specialized facilities. Proximity to other healthcare institutions and research centers may facilitate collaboration and resource sharing. But there is competition also. So now take 2 minutes to analyze or do SWOT analysis of your exercise physiology lab. How many faculties are joining? Have joined this? How many faculties are there? Dr. Twinkle? So in 2 minutes, do the SWOT analysis of your institute. How to set an exercise lab. Think about the strength. How many faculty members are there? How many PGs, or have you got the demonstrators there? How many instruments? If it is a PG institute, postgraduate institute, you have sufficient funding and the instruments. These are the tests you can do in your lab. Simple height, weight, and BMI calculation. Everyone knows this. BMI is a predictor or simple screening tool of health risk. You have BP instrument, stethoscope. These are the human lab experiments to record the respiratory rate. In my lab, these tests are for PG students for research or the intramural research or the PG students. 6-minute walk test, hand grip strength, fat analysis, VO2 max, heart rate variability also, and you can add spirometer also in this lab. The spirometry, heart rate variability, VO2 max, body fat analysis, hand grip strength dynamometer, and 6-minute walk test are sufficient to assess the performance of an individual. This is waist hip ratio. It's a simple anthropometric measurement. This one is non-stretchable tape. So it's a quick measure of fat distribution that may help indicate a person's overall health. Higher WHR indicates more central or abdominal fat, which is associated with an increased risk of certain health conditions like cardiovascular diseases, type 2 diabetes, and obesity-related conditions. It is considered a better predictor of health risk than body mass index in certain populations. It is calculated by dividing the circumference of the waist by the circumference of the hips. So for this, use a flexible, non-stretchable measuring tape for accuracy. These are the values given by the WHO, World Health Organization, for men and women. This is the table adapted from ACSM. This is the screening tool, mainly the screening tools, waist hip ratio. Then 6-minute walk test. One more thing, this waist hip ratio one more point, waist hip ratio it doesn't differentiate between fat and muscle mass. So it may not be suitable for all populations such as athletes with high muscle mass. This is the limitation of this. Then 6-minute walk test is a simple and widely used assessment tool to measure the distance an individual can quickly walk on a flat, hard surface in a period of 6 minutes. It is often used as a submaximal exercise test to assess functional exercise capacity, especially in individuals with cardiopulmonary diseases or other conditions that may affect their ability to perform physical activities. So for this is a very simple test. RPGs are doing research on it. The individual should wear comfortable clothing and appropriate footwear. In this baseline measurements such as heart rate, blood pressure, and oxygen saturation may be taken before the test and after the test. So American Thoracic Society or the ATS guidelines has given the guidelines for 6-minute walk test. The walk is conducted on a straight, flat, hard surface, usually along a corridor or track marked with cones at every meter. During the test, the individual is allowed to rest or slow down if needed, but encouraged to resume walking as soon as they feel able to do so. So as I told, the person's vital sign such as heart rate, blood pressure, oxygen saturation are monitored during the test. The total distance walked is 6 meters is recorded. The distance covered is often used as a measure of functional exercise capacity. Test provides insights into a person's ability to perform activities of daily living and may be used to monitor changes over time. The 6-minute walk test is generally considered safe, but it may not be suitable for individuals with certain medical conditions or mobility issues. So it's essential to follow the standardized protocol and guidelines when conducting the 6-minute walk test. Next instrument is hand grip strength dynamometer. Important indicator of upper body strength and overall physical function. Those who have joined late, I am telling about the instruments that we are using in our lab for research work or for fitness awareness program. So these are the simple instruments. It is an important indicator of upper body strength and overall physical function. It is often part of a battery of tests used to assess physical fitness and function. So mainly the hand dynamometers are commonly employed in clinical research and fitness settings. The person being tested holds the dynamometer in the hand to be measured with the arm at the side and the elbow at a right angle. We give three times to do or repeat this activity, and the maximum value that we get will be the final result. The individual is then instructed to squeeze the dynamometer handle as hard as possible. The maximum force exerted during the grip is recorded. This screen shows the interpretation we have clinically, shows the various values with present value and the reference value. This screen, everything shows. So then we clinically correlate the findings. The next is body fat analyzer. Body fat analysis refers to the process of determining the proportion of fat and non-fat mass in the body. In my department, we have bioelectrical impedance analysis, BIA, body stat 1500 MDT. Few residents measure skin fold thickness also. So both are for body fat analysis. This one is accurate. There are various methods for analyzing body fat. So skin fold calipers measure the thickness of skin fold at specific sites on the body. Example, triceps, abdomen, to estimate subcutaneous fat. The measurements are then used in equations to estimate total body fat percentage. So this one is a crude method. Then this one, bioelectrical impedance analysis, measures the impedance of electrical flow through the body. Fat tissues has lower water content and higher resistance compared to lean tissue. So electrodes are placed on the skin and a low level electrical current is sent through the body. It is battery operated. We put cell in it. This is quick and non-invasive, but may be influenced by factors like hydration level. So in body stat, we get the report like this. It's see here normal value and the reference value all here mentioned here. We fill the age, height and weight. It automatically gives the waist tip ratio, waist and hip, fat, lean, dry lean mass, water, hydration, BMR, etc. Everything is calculated. And it has wellness marker also. So ACSM, American Center of Sports Medicine, has also releases this table related to the fitness category, male and females. Next is gas analyzer, VO2 max. This is the recent instrument that we have got. Last year we have got this. So this is the metabolic module for calculating metabolic parameters as VCO2, VO2, respiratory exchange ratio, and minute ventilation. Basically, we can record everything from this like HRV also or the spirometry also. But at present, we are calculating only the VO2. So maximal oxygen consumption is a measure of the maximum amount of oxygen that an individual can utilize during intense or maximal exercise. It is often considered the gold standard for cardiovascular fitness and aerobic endurance. VO2 max is expressed as millimeter of oxygen consumed per minute per kilogram of body weight. The general recommendations from organizations such as American College of Sports Medicine and other health authorities often focus on promoting regular physical activity, which can have positive effect on cardiovascular fitness, including the improvement in VO2 max. So this is the important indicator for cardiovascular fitness and aerobic endurance. It reflects the efficiency of the cardiovascular and respiratory system in delivering oxygen to the muscles during exercise. So regular aerobic exercise, especially activities that elevate the heart rate and involve large muscle groups like running, cycling, swimming, can lead to improvement in VO2 max. High intensity interval training has been shown to be particularly effective in enhancing VO2 max. So this instrument is very, very important. So VO2 max testing is commonly used in sports and exercise physiology to assess an individual's fitness level. It is often used in research and clinical setting to evaluate the impact of interventions on cardiovascular health and to assess exercise tolerance in certain medical conditions. But important thing is, keep in mind that while VO2 max is an important marker, overall fitness involves multiple components, including strength, flexibility, and skill-related factors. So as per your vision, what do you want in your lab, you can set or you can purchase these instruments. These are the values. VO2 max, normal values for women and men, age wise. So important, we have autonomic function lab also, separate ANS lab. So, but there are battery of tests to check the sympathetic and parasympathetic nervous system separately. We do during the PG duration. PGs do this test. Now, advanced machines are available to record cardiac and autonomic activities. So, VO2 max, body fat analyzer, HRV machine, heart rate variability, and spirometry. These are the advanced machines to check the health status, cardiovascular and the respiratory status. So battery of tests that we do in our lab, various cardiovascular reflexes, Valsalva maneuver, expiration, inspiration ratio, hand grip strength, cold pressure response, and posture, effect of posture on blood pressure, and head up tilt test. All we study during the PG time. So you all know about this test. I'm not going in detail. So till you get the machine, you can check the awareness or check the fitness of an individual by these battery of tests also. No excuse. If you want to do, you can start your lab and start doing your work. Now, coming to the standard operating procedure, always make SOP for various instruments. What to do, how to do, what are the various precautions. So list all the instruments and consumable items. Mark on the instrument the date of the next service or the maintenance. AMC is very, very important. Take annual or the 5 years AMC. Take consent of the subject or the patients. Keep a record and obtain necessary approval or permissions from institutional review boards or ethics committee. Being a physiologist and the doctor, we can start fitness awareness program also, because Fit for All campaign is going on. We can organize camps during morning time in the park or the social or the various societies. You can take help of various NGOs also for the fitness awareness program. Here I do in my lab, I enroll 5% weekly for this program and monitor them for 3 months. I will tell you the key points related to fitness awareness program. What to tell the patient or the subjects or the public. First, I tell them how to check fitness at home. First, check if there is breathlessness during walking or climbing the stress. Check the pulse rate. Check respiratory rate. During COVID time, mainly we learned all the public learned the breath holding time. We can educate them about the waist hip ratio also. And BMI calculator is on all the mobile. We can teach them how to check BMI. Important point is how to maintain fitness. Everyone knows the importance of importance of exercise, importance of healthy diet, importance of sleep. But how to do that is different. So I tell them the 4 stages or the 4 things. Number 1 is about determination, how to spare time for fitness, work distribution, time distribution, about the healthy diet, and about the exercise. So determination means realizing the need for fitness, setting up individual goals, long term or the short term, understand the body composition and physical potential, adhering to the fitness protocol. Then for the common public, there is, I tell them 8-8-8 rule. 8 hours each for work and sleep and 8 hours to self. I'm telling this because if you want to serve the nation, if you want to do something, you can start fitness awareness program also from the exercise physiology lab, because you need blood pressure, BP instrument, stethoscope, and simple instruments to check the functional status of the public. Then 8 hours to self, derive just 30 minutes for yourself. Role of vitamin D and sunlight. WHO recommends 2 to 3 times a week for about 5 to 30 minutes each time, depending on factors such as skin type, season, time of day, and geographic location. So exercise, I advise exercise to improve. We know prescription is aimed to improve physical fitness, reducing disease risk, and treatment of illness. The fitness involves cardiorespiratory, muscular endurance, body composition, and flexibility. Fitte principle related to the exercise. As we see that these days, youngsters start exercising, severe exercise, but we have to tell them about the frequency and intensity, about the maximum heart rate and the target heart rate. So target heart rate, so start from 50 to 80, start from 50% and then reach to the 85%. 50 to 85%. So don't do vigorous exercise. If you are a sedentary person, start from the 50% of the target heart rate and then 3 to 6 months increase it. So increase 50 to 85% over a period of 3 to 6 months. Duration, start with 30 to 60 minutes and 50 to 30 minutes twice a day. You can divide the time also. This is a recommended aerobic training. I tell them about the diet also. My time is over, so I am shifting my slides. So time of, here main thing is quantity and quality of food matters. Quantity, breakfast, heavy breakfast, and dinner should be light. The fitness awareness program takeaway message is spare 30 minutes to 1 hour time for yourself. Do exercise. In diet, take healthy, balanced diet. For healthy bones, exercise, balanced diet, sleep, and rest are important. So conclusion is be positive and creative. Make good use of available resources. Acquire necessary permissions. Follow safety measures. See the participant comfort. And just start working towards your vision. You can take help of other departments, NGOs, and funding agencies. So all the best. Thank you.
Thank you very much, ma'am. If you permit, we can have a live right now question, 4 or 5 questions at present, if any burning questions are there. Otherwise, the rest can be answered in your Google link.
Yes, and I will share my Google link, and they can ask any answer or give the suggestion on that. And link will be open for 2 days.
Sir, can I ask one question? I'm Twinkle Raj here.
Please go ahead.
Ma'am, my question is that during instrument discussion, you discussed about the VO2 max gas analyzer. So I just wanted, can you just highlight a small differences, or is it the same between CPET tests that we do and just the VO2 gas analyzer? That 9-panel CPET that we are doing, and between the gas analyzer, ma'am, can you just throw some light?
Actually, I have not seen the CPET. We are using gas analyzer, VO2 max gas analyzer. It is multiple channel analyzer. We can yes, we can measure heart rate variability in spirometry, and this one VO2 max. All the parameters at a time. If someone is doing exercise, during exercise we can record all the parameters. So I have to check that also. Then I thank you. I will share the link in the chat also. Okay, Google link.
Thank you, ma'am.
Dr. Sridharaj, you can proceed for the certificate and next session. So, madam, thank you very much for your kind words and lucidly explaining all the process of how to establish it. And for the benefit of attendees, we have added all the 3 resource person in our attendee group also, so they can also ask question in WhatsApp group. Madam, I request you to please unshare your screen.
Okay. Am I audible?
Yes, go ahead.
So thank you, ma'am. And now I would like to introduce our next speaker, Dr. Hitendra Gupta, sir, who has completed his postgraduate diploma sports medicine from the very famous Netaji Subhas National Institute of Sports, that is situated in Patiala, Punjab, which is one of the very few institutes in India which provide NMC recognized post-graduation courses in sports medicine after MBBS, of which the exercise physiology is one of the very major subjects. He has also done hands-on training about the physiological monitoring of elite athletes at Sports Authority of India in Bangalore, Karnataka. He has also completed his certificate course in evidence-based diabetes management from PHFI. He has also worked as a team doctor for Rajasthan Royals in the IPL Season 6. He has also worked at Dr. P.K. Shetty Artificial Limb Center, Jaipur, to study about the human biomechanics. He has immense interest in the field of fitness assessment, weight loss strategies, nutrition science, especially for special populations like hypertensive, diabetics, and pediatric nutrition. Now, currently, he is working as an associate professor in Department of Physiology at GMERS Medical College, Porbandar, Gujarat. I welcome you, sir, and I will allow you to start sharing your screen. I'll stop sharing my screen and carry on the further session. Thank you very much, sir, and please welcome to the session.
Thank you, Dr. Twinkle. I hope I am audible properly. My voice clear?
Sir, I would request you to please
No, sir,
unmute
your
yourself.
voice is not clear.
Okay. Like the voice is low or disturbing or something?
Yes, sir. Now,
Okay. So yeah. First of all, good morning to everyone, and a special thank you to Dr. Chinmay sir for giving me the opportunity to present this session on the role of physiologist in the field of sports medicine and exercise physiology. So I'll start with it. Yeah. So first of all, like we need to have a clear demarcation between a physiologist, like the MD physiologist, and exercise physiologist. Like our role as MD physiologist and exercise physiologist, like what is the difference? First of all, since the exercise physiology field in India, like there are very few institutes which are providing the post graduation or specialization in the field of exercise physiology, and mainly the PhDs, mainly MSc and the PhDs, they are working in the field of the exercise physiology. So how we can enter into it, and what we can do in our medical institute or in hospital or on field. So I have divided my presentation into two. One is how we can work with the athletes or with the students, like the school student, college student, or the university student, like the on-field exercise physiology. And one is in the lab, what we can do in the lab, and the other is like what we can do with the in the hospital population, mainly the population which comes to the hospital, mainly the lifestyle diseases like diabetes and hypertension and all. So what we can do about that? So uh, exercise physiologist is who is the exercise physiologist first of all? Is a healthcare professional who is specialized in the study of how the functions work during the training, exercise, and physical activity. So on field, what they do? They analyze, they interpret the physiological measurements to make the guided programs, to make the training programs, to monitor the athlete's well-being, the fitness level, and then the tailor-made programs to increase the performance of the athlete. In hospitals, what we can do is we can deal with the wide varieties of patients. So we need to have a understanding of human anatomy and physiology, a deep understanding. And the main aim is, like I'm talking about the on-field exercise physiology first. So for that, the main aim is to optimize the performance of the athlete, of the player, or any enthusiast. For example, a marathon runner comes to us and asks that his timing is not increasing or his timing is not decreasing, like the performance is not increasing. So what could be the problem? So as physiologists, what advice, or as doctors, what advice we can give about the diet, about the physiological monitoring, or about the other things? What problem is there in his fitness level, whether he's actually okay for that particular sport or not? So what we can do is on field or in the lab for athletes and for the sports player, particularly for the sport, we can go for physiological testing. Like as already ma'am, Dr. Archana ma'am, she has already described a lot of tests and fitness tests. So I'll not go in much of detail, but I'll just pick up the point. Like for example, the fitness testing, the different tests are there. Assessment of the body shape, body structure, and act as a team player. We need to collaborate with different other parts of the uh, uh,
You are neither visible nor audible.
Is it okay now?
Yes, better.
Yeah. So we need to design the individual training program, analyze the goals of the athlete, assess the need, and prescribe the exercise. And the important part is managing and preventing the injuries. So as physiologists, we have an important role in managing the injuries also. If the person is fit and particularly for particular exercise, for particular sport, so he'll be having less injuries. So what we need to do, we need to do the in-depth progress tracking, modify the training plan, what training he is taking during the course of his uh, during the sports which he is playing. So
Your
by
screen sharing is not visible. Your screen sharing is not visible.
नहीं, अरे म्यूट हो गया, पता नहीं साला कैसे। हाँ बेटा।
give me 1 minute. Give me 1 minute.
Give me 1 minute. Just
Give me 1 minute. Give me 1 minute. Give me 1 minute. Give me 1 minute.
there's some technical issue here.
Can you just share the screen again? If you go on the Windows, there will be a button to stop sharing, and again you can reshare. Okay, yes, sir.
हेलो
Yes,
सर
your
थोड़ा
screen
टेक्निकल इशू
sharing
हो रहा है सर
is
यहाँ पे
now visible. Yes, sir, you can go ahead.
मैडम का आप शुरू कर सकते हैं मैं थोड़ा लैपटॉप में कुछ इशू आ गया है जी जी
Good morning, everyone. Sorry for the interruption. I think there is some network issue with the internet connection. Internet connection with sir's side.
Don't make panic. Be comfortable. It will be corrected. It is a technical issue. Dr. Hiren will be all right. Don't worry.
સર હિતેન્દ્ર સર નો ફોન નહીં લાગતો ડાયરેક્ટ સ્ટાર્ટ કરાવી દો મેડમ Sorry for the interruption. I would like to now introduce our third speaker, Dr. Harpreet ma'am, who is Associate Professor in Department of Physiology at Jawaharlal Nehru Medical College. She is also exercise physiologist and running an exercise physiologist and clinical nutritionist and sports nutritionist. She is executive editor in Indian Journal of Health Science and Biomedical Research. She is assisted in registrar in KLE University, Belgaum. She is also director Samagra Wellness Clinic in Belgavi. She is also member of Khelo India and she has published more than 50 full-length papers and she has received awards for more than 40 awards at national and international forums. I welcome you, ma'am, and I hand over you to the next session to continue through our seminar.
Thank you so much. Just give me 1 minute. I'm just loading the PPT. Just give me 1 minute.
Dr. Twinkle?
Sir,
Yeah, I was really sorry. Some issue came up, internet issue and all. Can I resume it, or Dr. Harpreet, or she's giving the presentation?
sir, if you can resume, okay, fine.
Yeah, I'm resuming it. Sorry.
Okay, sir.
Yeah.
Okay.
Now
Ma'am,
it's visible, my screen and everything?
yes, sir. Yes, sir. Your screen is visible.
Yes, sir, your screen is visible and you are clearly audible. Go ahead.
Yeah. Okay. Thank you so much. Thank you. Yeah. So I was talking about the interpretation and monitoring on field. Okay. So first of all, the interpretation of the anthropometry, which can be done on field or in the hospital setting, as told by Madam. Like we can use the various type of calipers, or so what is the importance of anthropometry in sports performance? The first is optimal performance, injury prevention, and talent identification. Talent identification is one of the key reason to get the player on top, and which can be done easily at the school level or at the university level by doing the anthropometric measurement. And then decide how which sports is specific for what type of body, which can be. So what are the key anthropometric measurement in sports, like the skeletal structure, limb proportion, and body composition? Skeletal structures like measurements such as body mass index, body fat percentage, body density, which provide the insights in athletes' overall health and physique. The limb proportions like length, circumference of limbs are measured to evaluate an athlete's agility, reach, and potential for performing specific action in sports. While the body composition involves the assessment of muscle mass, fat distribution, and body segment ratios, helps to determine an athlete's strength, power, and endurance capabilities. Like in basketball, if someone is tall, so that person is okay. That person, and if it has a good agility, that person can be taken in the basketball. Cycling, anthropometric measurement give the aerodynamicity. If the person is lean and optimal aerodynamic profile is there, that can be taken in the cycling. For example, swimming. In swimming, the hand span, the ratio of limbs is very important to select for the swimming. The conclusion is it's a valuable tool in the sports analysis, providing essential data for performance enhancement and talent identification. One of the important key factor, or one of the important tests to be done on field, is lactate threshold, which can unlock the athletic performance. Now, what is lactate threshold? Lactate threshold is the exercise intensity at which the lactic acid production exceeds its removal, leading to fatigue. So various factors are there in which people have different kind of lactate threshold. Okay, someone maybe have low lactate threshold, someone have high lactate threshold. That depends on the various factors like genetics, training status, diet, and influence on individual's lactate threshold. Now, there are various training methods which can be incorporated in their training regime by physiologists so that they can improve their lactate threshold level. So how can they improve? How, for example, high intensity is a very important, a very good tool to increase long slow distance training is another method. Tempo is a super maximum long distance. Okay, and there are various methods to calculate the pace of the tempo run. What pace the person should run. For example, a marathon runner is there, or if you get fatigue easily, the tempo run can easily increase its threshold levels. So how the measuring of lactate threshold, the measuring of which can be taken to the, and the lactate levels can be measured at different types of the intensity of the exercise, and the graph can be done, and we can find out at what level the lactate threshold, the lactate is increasing exponentially by heart rate monitoring and field test. So it is very important for the marathon runner. They can improve their lactate threshold through targeted training, resulting in dramatic improvement in race times, professional cyclists, and in triathletes. The conclusion of doing the lactate threshold is a critical aspect by endurance performance. To increase the endurance performance, we should focus as physiologists on the improving the lactate threshold of a subject or the. Now coming on to another parameter of fitness, which is called as muscular endurance or muscular strength. Both are different things. Muscular endurance is the repetitions, how many repetitions that person can make. And muscular strength is of course, the strength of the. So that test can be done easily on field or off field, like many gym goers. And these patients or the subjects, the gym going people, they come to us, to the doctors, and they ask like how to increase the strength. So first we need to assess how much strength they have. Then only we can make a tailor-made program for them, and then we can tell them, okay, what targeted muscles you can improve, like that. So first we need to evaluate the fitness level, which is like determining the individual's current muscular endurance and strength, and then we have to track the progress, whether by giving that particular program that person is progressing or not, and identifying the imbalance, which is very important. If there is a imbalance between the different muscle groups, then the person may not develop a very good strength. So to increase the performance, yes. So what are the benefits of muscular endurance and strength training? Rather than these days, rather than going for the aerobic training, the anaerobic training or the muscular endurance and strength training is in the focus, because it increases your BMR for a longer duration of time, helps in the muscle building, helps in the weight loss as faster as compared to the aerobic fitness or aerobic exercises like the jogging and long distance running. So it increases the performance, prevents the injury, and improves the overall health of the person. The strength training. What are the common methods for testing the muscular endurance? Endurance, we mean, is increasing the numbers of repetitions. So there can be push-up test, how many push-up that person can take. Plank test. Plank test is very good assessment, and which can be done in the lab or in the on-field. Sit-up test, burpees test, how many burpees that person can make. So the normative data is already there. Various studies have been done, and normative data is already there, and the data of the patient or the subject, which we can compare with the normative data. So yeah, these are the few tests, like the bench test, modified dip test. This is the modified dip test, also involving the triceps, basically abdominal muscles and the hamstrings. Abdominal curl up test, crunch test. Something called as rep max test, or something called as repetition max. Repetition max is like the one rep the person or the subject or the player can do one maximum repetition with the maximum load, to which defines the strength or the power of the muscle of that particular group. Grip strength test, which can be used by a simple hand dynamometer. Bench press test, which assess the upper body strength. What are the factors influencing the muscle endurance and strength? The factors could be like training volume, how much training that person is doing, the nutrition status, the recovery, whether the person is recovering or not. For example, if the person is just going under the rigorous training but not recovering well, that subject or the player will go into the overtraining syndrome. And the genetics of that particular person, of course, the number of muscle fibers, the quality of the muscle fibers and all. How to interpret the result? The results can be interpreted by the simple data making and then compare with the normative data. So muscular endurance and muscular strength data can be compared with that. So the test has to be done regularly at regular intervals of time. It's not like that you do one day and then you do after 6 months or so. The focus should be on the form. When the person is doing the exercise, whether he's maintaining his form or not. Diversify the training. One type of training is not enough. For example, if he's doing push-up only for upper body strength, that will not make the good strength, because if he's going for the tracking exercise or for the climbing exercise, that push-up will not help much. So we have to target the different group of muscles, and the combining of endurance and strength training, both the training. So a good rule is, like, if the player is doing 5 days training in a week, 2 days of endurance and 3 days of strength training is a good combination. And again, depending on the intensity of the exercise and the capabilities of the player. Some principles of the exercise physiology, something called as SAD principle, specific uh, effects on the intensity. For example, how other adaptive imposed demands, whatever demands we are giving, whatever adaptations is taking place, the specific adaptations in on the imposed demand principle, the physiological demand of the player has to be understood, so that the muscles can adapt it particularly. We have to think about the overload principle, whether the subject is going on the in the overtraining syndrome or not. If the person is going into the overtraining, we can assess again by different parameters, but that has to be taken care. Periodization is very important, that what time the training should be there, what time the recovery period, rest period. If the person get injured, how much time the player should take for the recovery and for the rest. Now, coming on to the benefits of the exercise physiology, as we physiologists, what we can help in the chronic disease management, especially in the hospital setting like diabetes, heart disease, and obesity. Enhance the sports performance. If the player comes to us, we can always help them to increase their performance. Stress relief and mental well-being. Overall, stress relief is done by the exercise as a well-known fact, and the mental well-being is improved by doing the regular exercise, which we can. Now, what are the common conditions treated by the exercise physiologist? Cardiovascular rehabilitation. So, along with the physiotherapist, along with the dietitian, nutritionists, in a hospital setting, which can be done, cardiovascular rehabilitation. So, on the website, as ma'am told, as on the American College of Sports Medicine, there's a lot of data given. What exercise to be given in the patient of the hypertension, in the metabolic disorders, and how to monitor those exercises, which can be done. Orthopedic rehabilitation, if we have a role in orthopedic rehabilitation also, when after the surgeries or after any injuries, the what kind of musculoskeletal testing we can do, and then a tailor-made program can be given to the patient. So in the gyms or in the schools, we can create personalized programs, group dynamic exercises, and then monitor the exercise, how whether the person is properly doing the exercise, whether the person is getting results or not. The biochemical markers can be done, and then according to that, we can do the change in the diets and change in the exercise programs of that particular clients. Now, coming on to the physiological monitoring in sports. Why monitoring is sports for athletes or for common people for that matter? For increasing the performance, injury prevention, recovery management, and health maintenance. What type of data can be collected and monitored? We can collect the cardiovascular data, heart rate, blood pressure, cardiac output, respiratory, like oxygen consumption, like VO2 max is the gold standard for doing the fitness testing, both cardio and respiratory fitness testing, which can be done. Lung function test, that's spirometry, and ventilatory rate, and all those. Energy expenditure, which type of energy zone the person is when he is doing the exercise, when he is for cycling or marathon, whether he is going in the anaerobic zone, whether he is going the aerobic zone. So that can be easily done by doing the RER levels, or by doing the RER. And lactate levels can be done. Substrate utilization, what substrate this person, carbohydrate, protein, what substrate that person is utilizing during the exercise. So what are the benefits of testing? We can predict the future performance, indicate weaknesses where the subject is weak, improvement, and enable the coach to assess the success of his training program, place the athlete in an appropriate training group, motivate the athlete, and yes. So yeah, this is one of the gas analyzer. Okay, Cybex. There are various monitoring methods and devices. For example, heart rate monitor, chest straps, wristbands, or smart clothing. Oxygen consumption, portable gas analyzers, and metabolic carts. Lactate threshold using blood samples or non-invasive methods. Some future is the virtual reality training, which can be incorporated in exercise physiology, so that the person, what the player what he is targeting, can improve his performance. Variable tech integration and AI powered analytics are there. In this picture, this person is taking the blood samples from the earlobe for the lactate threshold. Another important is the sweat analysis in sports, which is very in these days. Sweat analysis is important for maintaining the dehydration status of the player during the game for the optimal performance, preventing the fatigue. So what they do, they take the sample of the sweat before the exercise or before the training or before the game, whatever game that that player is playing, and after the game they take the sample of that sweat, and they measure the differences between the electrolyte levels and the water level between the before game and after game, and that's how they can measure how much electrolyte that person has lost. And according to that, during the exercise, the hydration status can be maintained, the electrolyte. So the energy drinks which they take, they are not monitored. They are mainly hyperglycemic, in fact. So those according to that only, custom-made sports drinks can be made, and that can be given to the player. So what are the methods? There are various methods. The variable methods are there, high-tech methods are there, mostly not available in India. But there are, like, the lab methods are there, which we can take the simple sample in the swab sample of the sweat before game and after game, and the electrolytes level can be measured into the lab. After doing what we can do, we can make the tailored hydration and nutrition plans and enhance the recovery using sweat analysis to guide the post-workout hydration and replenishment protocols. Another important is heart rate variability. So as ma'am has already told, heart rate variability is done in our lab also, and which can be done on the players or on the subjects or on the patients which comes to us. So heart rate variability is how it can enhance improving heart rate. If we measure the heart rate variability, we can find out the parasympathetic and sympathetic autonomic balance of the player. So highlighting low HRV levels indicate readiness for optimal athletic performance and injury performance. Since my time was a little lost into the technical problem, I'm just trying to touch all the slides. What are the benefits of HRV training? The benefits are athletes routine. We can maintain the routine. When is the HRV is like deranged, when is the HRV is in the normal range, and then we can find out the routine of the player. When the parasympathetic is like the sympathetic overstimulation is there, we can stop or we can change the timings of the player. Same way that these things can be done on the normal subjects. So it gives valuable insights into low HRV variable training can be seamlessly integrated into sports recovery program, accelerating recovery, minimizing injury risk, and maximizing the performance. So it is a game-changing opportunity in sweat analysis. It is a game-changing, which we can do at university level and at the school levels, at it enabling the precise athlete monitoring and personalized performance enhancement. In the hospital, as already talked, hospital, what we can do in the hospital settings, we can improve the physical health, manage chronic condition through the exercise, assess the patient health condition, create personalized exercise plan, monitor progress. And our broad focus in the hospital should be to improve the aerobic endurance and whole body strength. So what we need to do, we need to do a medical history of the client prior to administration. Before giving any exercise prescription, a full medical history is important, and the test should be done before designing an individual exercise. The biochemical marker for the fitness levels and the physical fitness level for the physical fitness test like the muscular endurance, the aerobic endurance test, and then after that we need to make a exercise plan. Along with each client or with each patient, we need to discuss the short-term and long-term goals, assess the client to lose or gain weight, improve aerobic capacity, decrease heart rate risk factors such as high body fat and blood pressure level, poor cholesterol levels, and high blood glucose levels. The links are there in the PPT for the different papers associated with this. Now, what are the exercise prescription for different conditions? So this I've already covered. Important is creating lifestyle habit that promotes. So we physiologists, we can always promote exercise. We can always motivate them to have a healthy, balanced life. And since we have data with us, and we can always do the things on paper, we should not just prescribe the exercise for the sake of doing it. We should have a data before and after, whether they are improving or not. And that data could be the markers, the test, the results, the test we do, the physical fitness test and the biochemical test. What are the benefits of exercise in healthcare? So we all know the healthcare has numerous benefits, include improved cardiovascular health, improved muscle length, muscle strength, enhanced mental well-being, and decreased risk of chronic diseases. Exercise physiologist utilizes benefit to improve the overall health of patient. And most importantly, we need to collaborate. This is not a one-man job. We need to collaborate with other healthcare professionals, physicians, physiotherapists, and dietitians, and to make a team building and then improve the overall general health of the patient. This is example of isokinetic testing. We exercise physiologists, we can go for this isokinetic testing. This is there in Reliance Group, Dhirubhai Ambani, which I have taken this picture. This picture is from internet, but I've seen isokinetic testing there. What are the challenges faced? We physiologists, what challenges? Limited resources, time constraint, and resistance from patients. So we need to have a first team building. We need to have funds for it. And then, as ma'am said, we can start from simple tests and then we can advance into the things. What is the conclusion? The conclusion is a increasingly recognized field, and with growing emphasis on preventive care and personalized treatment, exercise physiologists will continue to play a vital role in improving the patient outcome and enhancing the overall healthcare delivery. This picture is from Sai Bangalore, where the VO2 max testing is done by something called as Metamax 3B gas analyzer, which is a wireless analyzer, and which analyze the VO2 max and other aerobic parameters. This is by the cycle ergometry. This is upper body cycle ergometry VO2 max testing, especially where the upper body is involved, like more of upper body is involved, for example, in boxing or rowing. So other methods are there, like the treadmill, arm ergometry, step tests are there. Already the Harvard step test we do in our lab, and 6-minute walk test, an aerobic threshold, which can be done. So these are already, we are aware of all these things. So with this, I conclude my lecture. I think I take a little bit of time because of the technical issue. And thank you for listening to me. Thank you.
Thank you very much, sir. It was a very wonderful session, a very informative one. I would ask any participants, if they have any question, they can post it in either our WhatsApp group or in the chat box in this WebEx. For that, there was one question, sir. Can I ask you?
Yeah, sure, please.
Sir, there was one question about monitoring the heart rate for field test and improving lactate threshold.
Yeah.
How do we monitor the heart rate?
Yeah, that can be done. So there are instant heart rate monitor like Polar company is there, which measure like beat to beat. Okay, like during the exercise,
Yes,
instant heart rate is there, and like there are protocols of like doing the lactate threshold levels, like after 1 minute or 2 minute or 3 minute of exercise, and that can be done easily. You can take the series of samples. You have to take the series of samples, and those samples are taken into the lab, and a graph is plotted against the heart rate and the lactate threshold.
Sir, is that graph plotting on our laptop or in the device?
Sorry.
That instrument that you are saying that the graph is plotted, is it in the device or on our screen, phone or laptop screen, which is connected to?
In the laptop. In the software, we
Okay,
have to
sir.
do that.
Okay.
Can
Yeah.
I ask a question, Dr.
Yes,
Hiten?
please.
Yes, sir. Go ahead.
Your lecture is very comprehensive and very informative, but
Thank you, sir.
we require that this should be inculcated or imbibed into the students or the physiologists of different states. If a schedule is made, how many hours you need to imbibe the importance of sports and exercise physiology? If we do a offline workshop, how many hours will be needed?
Okay, sir. So the volume, the problem is with my laptop actually today.
No
But
problem.
as far as I understood, you mean to ask like in the teaching of the MBBS students, this
No,
information, how many
not
hours?
for
Postgraduate students, sir. Postgraduate students.
PG students, to those who have made their career as physiologist. That is the question. If we
Sir, can
want
you
to
bit louder, sir?
organize a
Sorry.
offline session, how many hours you need?
Okay, sir. At least 30 hours, sir. We can make a
30
module
hours.
of it.
Yeah.
Yeah. Yes, sir. Because there are a lot of data.
Yeah.
Because only one thing, for example, lactate threshold, it
Yes,
needs at least 2 hours to understand.
correct.
So what we can do, we can make a modules of and incorporate in the PG courses. We can do that.
Okay, I will talk to you later and will do it
Right, sir. Right.
because I belong to Jharkhand state and sports is very high here and we don't have any such facility. I want to start one of them. I will talk to you
Yes,
later.
sir.
Thank you very much.
Definitely,
No
definitely,
problem.
sir.
Thank you.
Thank you.
Sir, one more question is there. Sir, should we go for Indian data collection or use the ACSM data for population for exercise prescription for Indian population?
Yes. No. We have a lot of Indian data available these days. We don't need
Okay, sir.
to follow that. Yeah, that we have a lot of studies already done. The normative data for Indian population is already there.
Okay, sir. Okay.
Yeah. I can share the data. You can just WhatsApp me the details. I can share the data, the normative data for all the tests is already there on the web.
Okay, sir. Okay. It would be great,
Yeah.
sir, if you can share all the normative data for all the test batteries, sir.
Yeah. Sure. Yes. Any more questions? Okay. Uh, Thank you then. Thank you, sir. Thank you,
Yes, sir.
everyone. Thank you.
Thank you,
Thank
sir.
you very much. Yeah.
So that was a great session from Dr. Hitendra Gupta, sir. Very informative, and thank you, sir, for giving your special time to this seminar. Now, I would like to request Dr. Harpreet ma'am. As I introduced her, she is also Associate Professor in Department of Physiology at Jawaharlal Nehru Medical
Introduced me
College.
already.
She is exercise. Good morning, ma'am.
Good morning. I think you have introduced me already. I think
Yes,
let's
ma'am.
see.
Yes, ma'am. Okay, thank you, ma'am. I will stop my screen share and ask you to start sharing your screen share so that you can share.
screen visible now?
Yes, ma'am, it is visible.
Okay. A very good morning to everyone. I bring greetings from KL Academy of Higher Education, Jawaharlal Nehru Medical College, and the society which I belong to, which is very close to my heart, that is Indian Society of Sports and Exercise Medicine. And at the outset, I would like to thank the organizers, Dr. Chinmaya Shah sir, to giving me this opportunity to present how to run a private exercise lab. Yes. So the first and foremost answer when this question was asked to me, okay, how, ma'am, you have to explain how exactly you are running the clinic. So my answer, the straightforward answer is collaboration. Without collaborations, the running an exercise physiology clinic is not possible. And these collaboration needs your team. Your team should be an exercise physiologist, physician, cardiologist, sports physician, physiotherapist, strength trainer, nutritionist. If it is athletic population, then definitely a sports nutritionist, a sports specific coach, depending upon the athlete which you are training with, and a psychologist and a sports psychologist. So this is what your team should be. And then we have to focus on three main areas as an exercise physiologist, that is testing, monitoring, and the implementation of the plans. And in our clinic, we basically cater to two groups of population. One is the patients and one is the athletic group. So when we come to these, as soon as any patient or any athletic client walks into our clinic, this is the protocol which we usually follow. We take their preliminary data and we give them the ample of time. We give them ample of time to fill all this questionnaire, because this all becomes the basis for us to design the exercise plan for them and to evaluate them thoroughly, and then implementation comes. So self-administered question, which I'll show you next. For their dietary recall, we usually do 24 hours dietary recall to understand if they are having any nutrition, if they're appropriately taking the nutrition along with the exercise regimes. And we take part Q, that is physical activity readiness questionnaire, which is there for everyone, which is readily available. I'll be sharing all those documents at the end of my talk. So these all we will give them to fill. Once they fill all these things, this will be transported to my laptop inside my cabin. I go through them and then we'll schedule their first appointment, because these basic analysis is required before I actually talk to any of my patient or any of the client. And then once they come, we in the first visit, when they come after filling all this data, we do their extensive anthropometric measurements and body fat analysis. And depending upon the first consultation, we will try to analyze that if we need to send them for some blood investigation or some other investigation, and ask them to even provide the visual logs of their food and also the exercise regime if they're already doing it, to send the visual logs of everything completely, because most of the athletes are using the fitness watches like Garmin and all. So we usually transport all the data from the Garmin to our software. We have the integrated software. So we usually take the data. We usually connect their watches with our database, and we'll take everything from their database and try to understand how their training regimes are going on. Now, physical activity readiness questionnaire, I have given the link for it. This becomes the basis for understanding what is your current fitness level in the beginning. And this is basically consisting of 7 very simple questions, which makes us to understand where the person stands right now. And we use this screening algorithm, which is again from the ACSM guidelines, which is having the 3 main items, that is physical history, that is physical activity history, presence of known, if it is a clinical population, known cardiovascular, metabolic, or renal diseases, and presence and signs and symptoms of any of these 3 diseases. Now we have, depending upon these 3 items, there is guidelines to divide them into 2 categories: the people who have never done the exercise, who have never participated in the regular exercise, and the people who have participated in the regular exercise. The people who does not participate in the regular exercise, so they don't have any symptoms or any signs of this, so we don't require medical clearance for them. As I have mentioned you that we have in the team physician and cardiologist, so we don't send them for the medical checkup. We start planning for them the exercise regime. But if we think that they have certain signs and symptoms while examining them, while doing the clinical examination, and if we feel that they're having certain clinical symptoms, then we send them for the medical clearance from their physician or the cardiologist before putting them into any exercise regime. And with definitely, if somebody is on treatment, then we ask them to get a clearance from the cardiologist to start with the exercise regime. Now, this is for the people who does not participate in regular exercise. For the people who participate in the regular exercise, again, the same algorithm goes, and we need the same, in the same way, we need the medical clearance if there is any presence of any even single symptom or sign of breathlessness also. Now, this is our risk stratification scoring. Like if they have, men are more than 45 years and women is more than 55 years, if there is any family history, if they have the history of cigarette smoking, sedentary lifestyle, obesity, dyslipidemia, or pre-diabetes. So this is how we classify them, and this then we'll put them into low risk, moderate risk, and high risk. So if they are moderate, low risk, we put them into mild sort of exercises in the beginning, and then we'll progress them depending upon their clinical condition. And if they're high risk, we ask them to take the clearance from their concerned physician, and then we'll put them onto the certain group of exercises. Now, if the same goes with the athletic population, we try to understand that in which cycle of the athletic this thing they are. See, for athletic population, the whole game is different only. It's not only this exercise prescription. It is all about first they have to undergo the 3 cycles. Okay, we have something called as macro cycle, mesocycle, and microcycles. So we need to understand in which of these 3 seasons the athlete has approached us. So depending on that, along with their strength trainer, along with their sports specific coach, we sit together, we schedule a meeting with strength trainer, with their sports psychologist, with physiotherapist, and with the physician, that is sports physician. We fix our appointment, and then we study that case, and then we make the exercise prescription for them on the monthly basis, and we keep monitoring them. Yeah, so this I'll be explaining in a while. So if it is health related, we are doing cardiorespiratory endurance, body composition, muscular strength, muscular endurance, and flexibility. My senior speakers have already explained about it. And if it is a skill related, we take agility, coordination, balance, power, reaction time, and speed analysis also into consideration. So body composition at our clinic, we are using the high-end bioelectrical impedance. Now, these bioelectrical impedance actually it actually is on the principle that it measures the lean mass tissue, because lean mass tissue is, as we all know, that it consists of water and electrolytes. So it's a good electrical conductor, whereas fat is a poor conductor. So we will get to know, I'll just show you one of these things. So we'll get to know exactly the muscle fat analysis, which is very helpful for us. This is the report generated, but we will get the segmental analysis as I mentioned with that. We have the higher end version of it. So we also get the fat analysis for each segment, like upper body, lower body, thighs, glutes, everything. Okay. So this is what is in-depth fat analysis is done. And then after that, we are working on body composition. So rest of the things my team will be taking. Body mass index, they will be calculating circumferences on these areas like abdomen, thigh, forearm, mid thigh, calf, arm, waist, and hips is taken into consideration. We have the data which we have to compare with. Then skin fold thickness, 7 common sites we usually use. And we use the standard data to compare that where they come. But usually this is only done when we are on our screening program. But in the clinic, we use bioimpedance method only. Now coming to the second part, that is muscular strength. For the strength, we are using 1 repetition maximum test. And 1 repetition maximum test, this becomes the isotonic strength test. We have something called as isokinetic strength test also. Isokinetic strength test, usually we send the athletes there in the Department of Physiotherapy, KLA Academy of Higher Education. So there we have the proper instrument to do the isokinetic strength test, and hand grip strength test is done routinely in the clinic itself. So all the earlier speakers have already explained you the first repetition maximum test, where we give the maximum load. So without the individual or athlete get fatigued, they will they have to perform this one repetition maximum. So this is isokinetic test and hand grip dynamometer and the normative value. Like that, this is for upper arm and lower limbs, I have told. Like that, we usually do one repetition maximum to assess the strength, even for the abdominal muscles, back muscles also. And we note down the values. Then we do the endurance test. We have different endurance tests. So this is the commonly YMCA bench press test we use in our clinic. And we can see I have put one of the fitness assessment of one of our athlete over here. So not only that YMCA test, we do actually the whole body analysis for the strength and the endurance. Like we do plank test, and we did 3 readings of each test. We do pelvic bridge, serial plank, push up, crunches, squat, rowing. There's a huge list of it. So for every test, the athlete has to come on a daily basis for at least 7 days, because on the if we do all the tests on one day, the athlete gets exhausted. So we usually call them for strength test one day, for cardiorespiratory endurance testing one day. Like that we have divided. So this is 3 readings. So we'll usually take average of 3 readings, and then we understand that where the athlete needs to be focused upon. So wall test. Then we come to the flexibility test. We have the genometer with us, which will measure the joint angle flexibility for the upper body and also for the lower also, and sit reach box test, which usually we have in our lab. Then along with the lower and upper body, we also have the upper trunk flexibility measurements, which is regularly done, and Apple's back scratch test, which is also regularly being done at our setup. Then coming to the cardiorespiratory function test, we usually measure VO2 max on field and in the laboratory by different methods, and then we calculate the metabolic ladder. Metabolic ladder, we earlier speaker also have mentioned that we have MET, that is your METs, which is amount of work and individually capable of achieving with regards to its oxygen uptake. So at rest, usually it's like the work done is 1 MET, and 1 MET is equal to 3.5 ml of the oxygen uptake. So we have this ladder, that is METs. We will count the MET at rest or at the activity, and then from there we have the different formulas to calculate the relative oxygen uptake, absolute oxygen uptake, then calories and total calories, and then we will see weight in pounds, and we will see how the person is shedding according to the consumption of the meds. Then cardiorespiratory fitness testing on the field, when we do with the athletes on the field itself, that is Rockport 1 mile test usually we do, or Cooper's 1.5 mile or 12-minute walk or run test, 6-minute walk test. It depends upon the strength, the duration of the training period of that athlete, or else if we are putting even the patients for suppose a simple running program or a jogging programs, and then also we will do this test. I'll just show you a sample at the end, that how we put this test into the picture. And in lab test, we are using Bruce protocol, that is graded exercise test, ACSM submaximal cycle ergometer test, and Astronom rhyming bicycle ergometer test to calculate the VO2 max. So we usually do this depending upon the intensity and grading. So these are the different protocols. Kindly mind me that there is no one protocol which fits to everyone. We analyze the athlete, and then we try to do the different tests depending upon their gender, depending upon their age, depending upon the duration of training, what they're doing, depending upon their clinical condition. There are so many parameters which make us understand that which protocol actually fits for this particular athlete or for the particular clinical condition of the patient. Now, this is one of the testimonial which I have just put it, that this para athlete were able to crack 2 national records after coming into proper training regime. And before that, they were only doing sports specific training, like they were only practicing swimming. But when they did exercise testing, we put them on the strength training along with the sports specific training. It made a huge difference. So these are the pictures, a few pictures from my clinic where we take different sessions and examinations, and not only the normal training which we give, we also try to give something called as functional training, that using equipments which are present at the home, like simple katori, simple pressure cooker, which everyone is at home. So some people say we can't afford even to, take dumbbells on everything. We can't afford to even move to the gym. So for those in public, as madam and sir both were emphasizing on public screening program and emphasizing the fitness program in the public. So this become a core component there, that we emphasize on doing exercise with whatever equipment you are having at home. But only thing is, you have to teach them how to do it in a correct way. The posture, the gait, the form makes a huge difference. And then your fit principles. So if it is particularly athlete, along with whatever they have the data, we usually send them for all these screening tests before we put them into any exercise regime. Yes. So as we know that when we design any exercise program for any of our athlete or any of a patient, we have to understand that we have three energy system working with us, that is creatine, phosphate, anaerobic system and aerobic system. Now we need to understand that which system is predominantly working for that athlete, and we really want to shift that system or train that system also for that athlete for his peak performance. So for that thing, we have to understand that in which category of the physical activity gradient person is coming, depending upon their maximal heart rate, VO2 max, MET, this is rate of perceived exertion, and resistance, that is your again repetition maximum. So this is the data, this is the nomogram that which we usually see, and accordingly we develop the exercise program for their different cycles. Now the principles of the exercise prescription what we give remains the same, that is sporty. It should be very specific to the sports which an athlete has opted for. There should be progressive overload. There should be reversibility also. We have to periodize every month, and it should be an individualized approach. Now, usually we very closely follow the FIT principles, that is frequently, how oftenly they should do. This is for both, for clinical population also, for whom you are going to design the exercise schedule, and for your athletic population also. So how often they are going to do, intensity is how hard exercise should be for an individual. So you need to determine your functional capacity by treadmill test or simply by talk test also, when you need to ask them to walk and keep asking them that are they feeling comfortable or no. So depending on that, we categorize into whether we have to put in them to low intensity exercise, moderate or high intensity. We also have the heart rate monitors. We also use the pulse oximeter when we are doing all these tests. Time is for how long? Are they going to do for 45 minutes, 60 minutes? We have the guidelines which say 60 minutes, which say 45 minutes. But again, what we have experienced will yield you the better results is customized plan. So you have to understand the mechanics, biomechanics of an individual, the nutritional requirement of an individual, the biochemical profile of individual, and initially all this test will help you to understand what is the current fitness of that individual, and then the individualized approach to put them into start them from 20 minutes to take them to 2 hours of exercise session also. But it should be a very customized exercise planning. And type, it all depends upon the individual clinical condition and facilities which are available for the patient and for the athletes also. Volume and progression. Now there are different type of exercises: strength exercise, resistance exercise, flexibility, balance. So again, you have to be very specific whether you are dealing with young population, mid-age population or elderly population. These all things will come into the picture. So when you're designing any of the program, exercise program, need analysis is the must. Exercise selection should be very appropriate. You have to specify training frequency, the order, like when they are going to walk, when they are going to do the strength training, for how many minutes they are going to do, for how many sets they are going to do, for how many repetitions they are going to do, how progressively they should do, and how you're going to increase the volume or decrease the volume. So if you have given them simple squat, if they're not able to do the squat, so how you're going to regress that squat, make them learn the normal squat and then go to the further form of the squats. So it's not that every person whom you say that sit and do the squat, they'll be able to do it correctly. Mind me, we have seen the results with the patient who will do the 5 repetitions but do them correctly versus 100 repetition and not getting any gains out of it. And rest periods, are very, very important for the recovery for even for both the populations, your clinical population, also for the athletic population. And with the simple principles, we are able to make the difference in society. So I have named certain athletes for 2023 itself who have been selected for World Championship, Khelo India, for BCCI Women Cricket team after enrolling for the exercise program, fitness evaluation, and nutritional program with us. So we have many success stories of athletes right now. Currently, we are working with more than 350 athletes of national and state repute. And we have more than 3,000 stories of patients managing their blood glucose level, diabetes. They have been switched from the insulin to the single drug therapy. But yes, in the brackets, by their physician and by their endocrinologist, we just have a constant word with them, maintain them regularly, and then we have seen the results. So as an exercise physiologist, our role is fitness testing and grading exercise testing. And that will only occur if you do postural analysis, gait analysis, range of motion testing properly, on time training with the principle of fit and progression overloading and supervised exercise program. So these are my acknowledgements. This is the centers which I work very closely with my collaborators. This is OMS High Performance Center for Athletes, Belgaum, Institute of Physiotherapy for different testing, where I send my patients and athletes and my collaborators, my trainees, my interns, my student, and my team. This is with what I would like to end my talk, that this is the time when we have to be very specific, and until unless we are the role model for the society, patients are not going to look up to us. So we need to practice what we preach. So we have to be at the field morning to see what others are doing, to understand what others are doing. Until unless you are into some specific game or into some specific exercise regime, you really will not be able to understand what is a requirement of a clinical population or even the athletic population. So it is the need of the time, I feel. And these are my social pages where you can connect with me with any time. And I usually reply to all of the queries within 24 hours. So that's all about. I think it's not difficult to run the exercise lab, but whole thing is you have to find your collaborators and team right. If your team is right, if your collaborators, you know your collaborators and your team, then and your work, then I think you can do wonders wherever you are, wherever you're stationed. Yeah. Thank you.
Thank you very much, ma'am. I would like any participants or faculties, if they have any question, they can post it in the chat so I can read it. Till then, ma'am, can I ask one question?
Yes, please.
Ma'am, can you please just throw some highlight about the cost of setting up such a private lab?
It is high. It's very high. It's very high. But that's what I didn't mention about the cost, but I was telling you, you find your collaborators. If you find your
Yes, ma'am.
collaborators, the cost effect goes down, and you can specify, you can only be very specific with what you are doing. Okay.
Okay, ma'am.
And if you want to purchase high-end instruments, then it goes really high.
Okay, ma'am.
But before setting up a lab, with the experience, what I have to tell you is study your population.
Yes, ma'am.
Work in the field, study your population. You should know who is coming to you. How many athletes are working in and around your city? You have to make a rapport with them and then think of putting this type of lab.
Okay, ma'am. Got it. Okay, ma'am. One suggestion is being asked that any book or material for references.
References of what? Can you be specific? Then
it is not mentioned, but I suppose it is related to exercise physiology.
Okay. There are
For
many
developing a
books.
private lab. Yes, ma'am. They have mentioned for developing a private lab, materials or references.
for developing a private lab.
Madam,
I don't think so that we have. It all
Hello.
came with experience. Yes, yes, yes.
Madam, on an average in your private setup, how many patients are there per day?
So,
I want to know the statistics.
yes, okay. Sir, because I'm working in a medical college also, so I
Yeah.
come to my lab and clinic early in the morning, during
Correct.
lunch, and evening 5:30 to 9. And I usually take at least 10 patients a day. My appointments are priorly fixed. There is no walk-ins. My team usually schedule the appointments for the day, and we have fixed 9 to 10 patients of 10 athletes, including the athletes for that day, because one consultation need almost 40 minutes. So depending upon that, it needs, I only can cater to 10 patients in a day, not more than that. And my work starts early morning at 4:30. I will be in the field with my athletes. So my testing starts at 4:30 in district stadium every day.
What is the charge for that? Per patient
This is
charges are
like,
fixed. It is there. Nothing to.
no, sir. So there are no fixed charges, I'll tell you, because when we do analysis
On an
we
average.
understand on an average, if you talk about an athlete,
Yeah.
Depends upon one athlete. For per monthly, we charge nominally something about 15,000 to 20,000.
Correct. So if I want to send a few of the PG students who have exposure over there,
Yes.
what is your expectation? Number of days they should be there to have a exposure session for them.
So right now, we have signed in the process of signing, I think MOU with Savita Medical College, the Department of Sports Medicine. They wanted to send the PGs to our center. So what we have told them, at least it should be at least a good 15 days to 20 days stay over here to understand what we are working, to understand how the things are going. So minimum of 20 days.
Correct. Correct. Thank you very much. Thank you very much.
Dr. Arpit, an excellent session. Dr. Singh is here.
Okay, sir.
So why by your big charges and everything, our physiology can inspire that even if specifically I would like to say regarding female people, what is happening that when they are doing PD, mostly they are unmarried. Once they get married, they have to get to as per their circular. So if you inspire them, they all can start their private sports and exercise clinics in respective places, and we are not limited to college. Right now, जहाँ पे college है वहाँ पे हमको anyway move to the place where the technical colleges are there. But with all our we would like to do that we all can start our own clinic like consultant physiology. So after a few years, there will be something like consultant physiologist and by your session and session of Archana Madam as well as of research, I think everybody has inspired and we can see the number of patients and number of participants right now. So anything which you have not covered in the presentation but you would like to say a tip to a budding physiologist, please share something like that. That what way would you put in mind?
Okay, so I will just share my experience, which is very near to my heart. Why I have chose, to come into the field is when I was doing my PhD, I was carrying at that time, and my PhD was with the diabetic patient and exercise. It was on the exercise therapy, structured exercise therapy with the diabetic patients, and there was one young fellow who was referred to us for the testing, and he was diagnosed with diabetes at the age of you can say 34, and that young man was really depressed. And at that time, when I saw him for the second time, I delivered immediately after that. I delivered, and I met him for the second time, and he was just staring at me. This is a true story which I'm telling you, which has which changed my life 10 years back. So he just looked at me, and I was explaining him everything. You have to do this, you have to do this, you have to do this. And he was like, he I think probably didn't knew that I have just delivered. He was like, look at you, and you are explaining it to me. Probably you will be diabetic in next 2 or 3 years. That was a silent but very loud message. So that was a turning point for me as a physiologist, which made me think, no. Our need is more in the field, and we should be the role models for the field, And this will only come when we come out of the four walls. There is a lot to do in physiology, but only thing is we have to come out of our four walls. We have to leave for some time blackboard and chalk, although I love it the most, but still we have to leave that and come out and then see. And it is not an easy job. Today, what I'm talking, it has come with the experience of 10 years. I have slogged for 10 years to reach wherever I am today. You have to make your rapport in the society so that people believe you and come to you with your name. So a lot of hard work is required. I think our postgraduates, our whole colleagues have lots and lots of hidden potential. Only thing is you have to understand your potential and come forward. We are here always with our experience. We have learned in a hard way. We'll give you a platter, that I can assure you. But journey is you have to go through your own journeys and reap your own benefits. Every individual will be different. No two cases, no two diabetic people will be same. No two PCOS women will be same. No two same sports athlete will be same. So it's like you are having a new experience with every patient and with every athlete. So there is no specific rule, no specific guidelines which fit. With every athlete, you will learn a new guideline. With every patient, you will learn a new guideline.
Ma'am, any licensing or legal requirements to set up the private lab?
Yes, sir. There are few. I'll mention them. I'll just make notes I'll make and share in the group. Give me some time, a week's time, I'll share, because somebody has asked if I can share the documents. I don't have any documents to say how to set up a lab, but give me some time. I'll write something in brief with my experience and share with you all so that it may help you in one or the other way.
And also a request from participants. So I request Ma'am and Chandra to permit us or you share your PDF of PPT in a group. So whatever you have shared will stay permanently with the participants.
Sure, I'll do that.
Hitendra sir, any tips from your side?
Ma'am, one question.
Yeah.
Ma'am, does the demography affects the area which you select? Matlab, if you are right now, previously sir mentioned that Jharkhand has a very high number of sports. Mumbai, Delhi, such places, Haryana have very high number of people who are active in sports. So people in, suppose I am from Gujarat, so here not much activity is there. So is there any difference?
So demography, if you're talking me with respect to the sports, one thing is exposure.
Yes, ma'am.
Okay. We have lot of potential even in the rural places over here in Belgaum also. So the athletes which I have put forward in one of the slide, they're all from the rural areas who have always been with the inferiority complex that if we go to the Bombay and Hyderabad or Pune for competing, the athletes over there having the high performance labs and will not be able to compete. So you have to, as an exercise physiologist, you have to take out that fear from them, and every every athlete can do their best. Second thing is, because the government schemes are very prominent in some states. See, I have met, because I'm the part of Khelo India, it's very sad figure, or although I'm very proud of to be a part of Khelo India, but I'll tell you the original facts. The athletes which were sent to me from the Khelo India, or I have approached them, they told, ma'am, we don't know anything about the game. We have come to the game in their local language. Only we are getting 3 meals, 3 proper good meals. That is the state today also. So yes, demographic has huge role, and we have so many untapped area where you can do wonders, I feel.
Thank you, ma'am.
So, dear participants, we will be sharing the link. Yes, Archana ma'am is also here. Now, Tinkal, can you take a photograph? As all the three person are here. You can take up our screenshot of our.
Dr. Twinkle,
Yes, sir.
I have to say something about this demographic question. Uh,
Yes,
like,
sir, please.
like if you compare the population of Cuba, it's around
Yes, sir.
1.12 crore. Okay,
Yes, sir.
it's like less than Delhi, but still they are like they are at top in the boxing.
Yes, sir.
So what could be
Good.
the reason?
Sir, it can be that.
Like if you see Haryana and Punjab, they are the two.
Yes,
These
sir.
are the two states which cover almost 90% of the athletics, and the
Yes, sir.
South India,
Yes, sir.
rest. Okay,
Yes, sir.
but North, mein, Madhya Pradesh, Rajasthan, Uttar Pradesh, they are nowhere in athletics. Mainly athletics. I'm talking about the athletics, not about the cricket.
Yes.
Cricket, mein, we have Saurashtra Cricket Association, which is doing really well.
Yes,
So
sir.
more than demographic, it is the government policies.
Okay, sir.
How much sports and how much funding they are doing. You know, like
Okay.
for Saurashtra Cricket Association is doing great because of the funding, because of the BCCI. But the funding there, like if you win a medal, they give you petrol pump, right?
Yeah.
So those are the things which creates this discrepancies.
Okay, sir.
But Hitendra sir, if you see, I have something to add on it. I'm not. You are absolutely right. Although the you know participation from Haryana and Punjab is maximum, but the medals coming out from other state is more, in spite of their less
Northeast.
number. Northeast is
Northeast.
more. So something is there, with the training. Something has to be there with the training.
I guess Barun sir is helping them a lot.
Yeah, Barun sir is not there today. I don't know if he's there.
See, we have tried to contact him, so he's having some internet issue, so he's not able to answer. So participants, as I can see that now the few participants are leaving. Dr. Shintala, can we have a feedback link in the chat box?
Yes, sir. I'll put the feedback form in the group, sir.
Okay. So all are requested to share the feedback so that we will generate a participation.
Can you be a little louder?
Yeah, so we will be sharing the feedback link in the WhatsApp group as well as here in the chat box. All are requested to fill the feedback form. So we will get the feedback as well as the name, what we will write in the feedback form. We will generate certificate based on that. And Dr. Kuntala, can you just share the certificate of Harpreet ma'am? Dr. Kuntala, are you sharing?
Yes, sir. Just.
So thanks, Archana ma'am, for your presence and your enlightenment in topics of sports physiology. Same way, thank you, Dr. Harpreet. So ultimately, we were able to do this. And it's after a long time. In the next 10 months, we are planning, but finally we are able to do it. Thank you very much for being here. And thank you, Chandra sir. What we made performance getting quiz, we are able to articulate it. So thank you, even in spite of all the challenges, you have made it possible. So I thank all the resource persons for being here and enlightening all of us. And I'm happy that this will be noted by American Physiological Society as we are doing it as an activity of Physiology 2023. And thank you all the participants. I am sharing the link of feedback form in the chat box. All of you are requested to please fill it, and link will be open in 1 minute. So any last question if anybody has, you can have it. If there is no question, I must thank our dean, Dr. Hannes Mehta sir, for the research person, my physiology team, backbone, as the department team we can't work. Thank you, Dr. Twinkle, for coordinating everything nicely. And our IT team, our all the resident doctors, R1, R2, R3, my department, all the faculty, with your support, we are able to do this. So thank you very one and all. Lastly, thank you participants. Without you, we are nothing. And you can continue your question answer discussion in your WhatsApp group. And the resource persons are there along with the boarding sir also.
So can we leave, sir?
Yeah, I
Permit
think
to leave?
everybody can leave. So we can end the session. So bye bye everyone.
Thank you so much, everyone.
Thank you very much, sir.
Again request to take Silver back home.
कैमरा चालू करके घूम रहे। कोई भी तो नहीं बोल रहे। कोई भी तो नहीं बोल रहे।